Hi, this is Stacy. So we're going to talk about OMM Guide to the Skin, and I think that this will be my last tutoring session for Derm. Uh, Quick note: if you're going to DO Day on the Hill, you're going to have to say hi to me. I'm doing my last rotation in DC, so I'll try to catch dinner with you guys. So let's get started. OMM Guide to Skin, which kind of seems odd, but we'll see what skin things and OMM things that we can do. So the mind affects the body. So anxiety causes perspiration. The body affects the mind. So psoriasis can cause anxiety or depression. The GI affects the mind as well. The gut can produce serotonin. Non-healthy gut, we have less serotonin, leading to depression, plus or minus obesity and diabetes mellitus. So what can we do for derm? We can increase a range of motion. We can increase blood and lymph, increase the balance of autonomic nervous system, and decrease impingement on neurovascular bundles. So let's talk about a rash on someone's arm. So let's say we're treating the cervical and upper spine. So there's going to be segmental, like let's say there's like scalene hypertonicity, there's tender points or soft tissue. Let's say there's a dysfunction of the first rib. So we want to decrease nociception, unload sensory receptors and spinal reflexes, and reset mechanoreceptors, decrease pain and increase range of motion. So maybe this rash on the arm, we can think about treating how we would treat a dysfunction in the arm. So if we work on the first rib, we're going to, maybe there was a brachial plexus impingement. Maybe there was decreased blood flow. So by treating this with the Stills technique of the first rib, we're going to increase blood flow. And if we treat the OA or AA dysfunction, we can treat parasympathetics. And if we use counter strain, it's going to reset those muscle spindles and relax the muscles, decreasing pain if this rash caused pain. Okay, so for acne, think there might be a lymph drainage issue. So consider working on the thoracic outlet or inlet that where fascia is bound. Maybe look at first rib dysfunctions and look at the head and the neck. So for acne, think about still technique for first rib to open that thoracic outlet, decreasing scalene hypertonicity, relaxing Sibion's fascia, and reduce mechanical obstruction. Also, counter strain and still for the upper T and C spine decreases that hypertonicity and relaxes the fascia. It's going to increase the range of motion and lymph flow and decrease impingement to neurovascular bundles. If there's a painful rash on the chest wall, such as shingles, think about treating the C spine, like OA or AA. So we're fixing the parasympathetics. Think about working on first rib or thoracic outlet, or second through 12th ribs or T spine. Don't be touching like the rash itself, but work on other things that go to the rash that would like nerves that would go to where the rash is located. So we could do a suboccipital release for our parasympathetics. We could do rib raising to decrease sympathetics. So remember, if we decrease sympathetics, we need to do our rib raising for greater than 2 minutes. If we do it less than 2 minutes, we're going to be affecting parasympathetics instead. Do still technique for first rib to reset nociceptors to decrease pain, and then still and counter strain for our C and T spine of our somatic dysfunctions. So that's all I have for OMM, but I would just really know these 3 examples, and I think you'll be fine for your exam. All right. Thank you. And if you're going to DC, I'll see you there.